Hello! Today we are going to be discussing first aid for kitchen accidents. The first scene we are going to be looking at is cuts. Kitchen knives are very sharp, and if you're not paying attention, you could easily slip and cut your finger. So let's go show a scene that will walk you through a minor cut.
What a lovely day.
Here we have a young lady who has cut her finger while chopping carrots. So what we are going to do is we are going to take the wound over to the sink. We're going to rinse it off with some soap and water. Let's look at this wound. Oh wow. Next, we are going to take a gauze pad or a bandage, and we're going to apply pressure to this wound until it has stopped bleeding. Once it has stopped bleeding, we're going to take some antibiotic cream and we're going to apply a little bit to the wound. And then we are going to apply a bandage to this wound. There you go, ma'am. You're all fixed up.
Boo-boo, all ready now.
As previously mentioned, that video showed a minor cut. So what if you have a major cut? You will know you have a major cut if the bleeding is severe and does not stop after 5 to 20 minutes of direct pressure. Or if the cut is longer than half an inch, has jagged edges, becomes inflamed, or oozes fluid. In this case, you will need to go to an emergency room immediately. Next, we are going to be looking at burns. A pot of boiling water or a hot pan can leave a very bad burn if you're not careful. So, in this next scene, we will show you what a first-degree burn looks like.
Ooh, I love this soup. Smells like it's ready. Alright, so we're just going to... Ooh, careful.
Here we have a young lady who has burnt her hand while serving soup. Let's get this taken care of for you. First, we are going to remove the jewelry around the wound. Next, we are going to run the wound under cool water for 3 to 5 minutes. Next, we are going to dry off this wound just slightly and take it over here. We are going to apply a thin layer of antibiotic cream to the wound. Next, we are going to apply a gauze pad and some bandaging to the wound. Never apply ice or oil or butter to the wound. As previously mentioned, that was how to take care of a first-degree burn. That burn should heal in 3 to 5 days. A second-degree burn is a deeper skin injury. It will usually turn red, blister, swell, and hurt. To treat it, you should soak the burned area under cool water for 15 to 30 minutes. Then apply antibiotic cream to prevent it getting infected. Cover with a cotton pad or sterile dressing. After each day, change the dressing/pad on the burn and check for an infection. Signs of infection include redness, swelling, pain, or pus. This wound should take 2 to 3 weeks to heal. It'll also start to itch during this time, but do not scratch it. For a 3rd-degree burn, this is a medical emergency. Cover the wound with a cool, wet dressing and call 911 or head to the nearest emergency room. This type of burn includes all layers of the skin and will have white or blackened tissue on top. It might not hurt. That's because the nerves in the skin are damaged. So how do you know how bad the burn is? See the doctor right away if the burn includes your face, your hands, or your feet, is on or near a joint such as your shoulder, your elbow, or your knee, or goes all the way around a part of your body like your arm or your leg. If it is longer than 3 inches or goes deeply into the skin. The last scene we are going to look at for first aid, well, third, not last, is falls. So in this next scene, we will show you what to do if you fall.
We're going. Oops. Maybe a little oops. Go. I better clean that up.
Oh no, she's fallen.
Okay.
Make sure to check yourself and make sure you have no broken bones. Now, get on your hands and knees and crawl towards the chair and try to pull yourself up. Oh no, she can't pull herself up.
Help! My father, I can't get out! 911!
Are you okay, miss?
No.
Okay, I'll call 911 for you. Do, 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 do. 911, what's your name? Falls can be caused by water or oil or anything on the floor that you could slip on. If you fall, follow these steps. Make sure that you are not hurt before standing up. Getting up in the wrong way could make the injury a lot worse. 2. Slowly rise to your hands and knees. Then try to crawl your way to a chair to pull yourself up. If you are unable to get up on your own, then yell for help or call 911. If the area is swollen and you think you might have a fracture or broken bone, do not try to move it. Call your doctor immediately or go to the emergency room. The last incident we are going to look at is eye injuries. So what should you do if you accidentally get lemon juice in your eye or you accidentally get splashed with a chemical while cleaning up? Do not panic. Follow these steps. Lean over the sink and pour a gentle stream of lukewarm water over your eye. Keep flushing it out for up to 15 minutes. Cover your other eye in order to protect it. Then call the National Poison Control Center at 800-222-1222. And I'll put that along the bottom here. If your eye is still irritated after you flush it out, call your doctor. Call 911 if you have a cut in your eye. Do not wash and do not apply pressure to it. 2, if you feel like you have an object stuck in your eye, do not try to get it out, rub it out, or apply pressure to it. And that is how to take care of 4 different types of kitchen accidents.